So you want to know about cash pay healthcare? Well, in this video, you'll learn all about cash pay healthcare and how it can avoid the complicated rules, inefficiencies, and expenses that are associated with getting routine healthcare through a health plan. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon, and this channel is all about routine medical conditions, self-care, and cash pay healthcare options so you can be informed and in control of your healthcare needs. If you want to know about fact-based healthcare, hit the subscribe button below. We get contacted by patients, employers, and providers regularly looking for ways to ease their healthcare burdens. So feel free to reach out with an email or hit the comment section below. So here's a summary of what this video is all about. So we'll talk about some of the many well-known problems concerning healthcare access when using a health plan, including big problems such as high premium costs, confusing contracts, the many unnecessary rules and restrictions, and so on and so on. Many of these problems, though, have an easy fix, a fix that can make much of healthcare a lot more affordable, convenient, and efficient for patients, employers, physicians, and providers. But before we get into it, we have to let you know about the disclaimer. The information provided by HEALTHdrum is for educational and informational purposes only and is not a substitute for professional medical advice. Consult a licensed physician for medical advice, diagnosis, or treatment. You can pause the video to read it completely, or you can read it in the description below. So let's get into it. Why is access to routine healthcare so difficult and inconvenient? Well, basically because the insurance industry has placed untold barriers and restrictions and controls virtually all pricing, access, and delivery of routine healthcare. So here we have a list of some very big reasons why the business of healthcare is totally out of control. First, a major reason is because the big health insurance companies are publicly traded companies and their business is to make money. And they do, making billions each year. As well, many big investment companies and hedge funds are also invested in these health insurance companies, and they want to make money at your expense. Clearly, the health insurance business is burdened with big financial conflicts of interest. Second, another huge problem is the fact that over 2/3 of all the healthcare delivered is generally affordable, routine, office-based, and outpatient care. And being generally affordable, routine expenses are not normally covered by the insurance industry. For example, your car insurance doesn't cover the cost of a new tire. That's a routine expense that you pay for. The real purpose of insurance is to cover significant or unusual costs and not generally affordable routine expenses. Unfortunately, the health insurance business is about the only insurance that covers routine expenses, and this fact is directly responsible for ballooning healthcare premiums. But here's a fact that'll make your head spin. 50% of the population consumes only 2% of healthcare dollars, whereas the other 50% consumes 98% of all healthcare dollars, in part because many in this group are not making good lifestyle choices. So the health insurance industry is very aware of this fact and uses risk pools to lump groups of people together to even out healthcare premium costs. This means that those making good lifestyle choices and staying healthy are paying for those that are not making good lifestyle choices and using more medical services. Another problem for consumers trying to get routine care through a health plan is that the health plan has removed your decision-making ability for who you can see and what you can have. It's not you, but your plan that approves, denies, or even rations your care. And even more egregious, Your health plan decides the health care that your physician can deliver for you. This is very troubling, as over 2/3 of all the health care that's delivered is routine care, and the access and delivery of routine care should be just between you and your doctor. So let's now look at some routine healthcare costs and then compare them to healthcare premium costs and deductibles. To make healthcare premiums affordable, millions of consumers and employers use high deductible plans or self-funded plans. Yet there's no easy way for consumers to manage their deductibles or other out-of-pocket expenses when using health plans. On average, most people make about 3 doctor visits or less per year, many of them to urgent care centers. On average, the fee for an urgent care visit is about $150. So for 3 visits per year, this would cost you about $450. Yet the average single member deductible for employer-sponsored insurance is about $1,700 plus your share of the premium. So there's a big difference between $450 for 3 visits and a premium with a $1,700 deductible. In other words, you only use about $450 of health care per year, but you pay $1,700 for coverage. Another problem is that most people with deductibles will cash pay and file the insurance claim for the visit. This is exactly what you don't want to do, because when you have the doctor's office file the insurance claim for a routine visit, you will be paying more, including copays, because when they file the claim, you get expensive insurance-based pricing and not free market healthcare pricing. Since most people with deductibles never meet their deductibles, you should simply cash pay for routine care with the cash pay price and not let the office file a claim. This way you get market pricing and avoid the copays. And because most consumers pay more for coverage than they get back in services, it makes sense for most consumers to get the biggest health plan deductible possible and cash pay for routine care and not file claims. This way your health plan is affordable and still available for major medical and catastrophic coverage. So how can we put routine health care back in the hands of consumers, employers, and physicians and make health care much more convenient, efficient, and affordable? So here's the HEALTHdrum Healthcare Marketplace platform. You can access generally affordable routine office-based and outpatient care, including imaging, labs, primary care, specialists, and alternative health. This represents over 2/3 of all the health care delivered. The product features a robust search, cost-transparent services, ability to compare services and costs, convenient scheduling request system, enables a priority access option for appointments, and an efficient payment platform. As well, the platform eliminates contracts, networks, needless paperwork like referrals, authorizations, copays, and surprise bills, and is highly efficient for patients, employers, physicians, and providers. As well, there's a convenient dashboard for employers where they can enroll workers and a dashboard for providers to assist with practice management. It's also important to remember that there's no evidence that health insurance has shown any improvement in overall health. As well, there's no evidence that wellness visits or annual checks have led to the improvement in overall health. So let's see how a cash pay healthcare marketplace for routine care can benefit patients. So here's just a few of the many benefits a cash pay healthcare system has for patients, especially when over 2/3 of all the healthcare delivered is generally affordable routine office-based and outpatient care. The healthcare marketplace platform is open access, online, on demand, lists cost transparency services, enables comparison of services and costs, and eliminates many of the barriers and restrictions to routine healthcare access, such as contracts, enrollment periods, referrals, authorizations, networks, and surprise bills. Even better, it can enable priority access and avoid the usual appointment scheduling delays when using health plans. So let's see how a cash pay healthcare marketplace for routine care can benefit employers and employees. Now, employers lower healthcare premium costs by choosing high deductible or self-funded plans. Remember, employers pay much more to have employees covered for routine care than employees actually use in services. That's why health insurance companies make billions in profits each year. High deductible plans lower your health premium costs, but they still cover you and your employees for major medical or catastrophic care needs. Since most patients don't meet their deductibles, the online healthcare marketplace allows workers and employees to budget for and manage their out-of-pocket costs for routine care. And, as explained before, routine care costs are cheaper when not filing an insurance claim to meet your deductible. As well, the online healthcare marketplace platform is highly efficient and cuts administrative burdens, as well as the many barriers to access by eliminating referrals, authorizations, contracts, copays, networks, and surprise bills. Even better, it allows those with HSAs a very convenient way to offset their healthcare expenses. And the HEALTHdrum Cash Pay product favors users with priority access so they don't have to deal with long scheduling delays. It's great for all workers, including part-timers and gig workers. Let's see how the cash pay healthcare marketplace for routine care can benefit providers and physicians. Again, over 2/3 of all the healthcare delivered is generally affordable office-based and outpatient care. The coverage of generally affordable routine expenses by health plans has allowed the insurance industry to dominate healthcare, control physician delivery of healthcare, and hijack the medical profession. To deal with these unnecessary layers of healthcare bureaucracy and administrative burdens, physicians have had to engage managers, consultants, and outsource much of their office work. The many fees associated with practice management consultants and outsourcing can be cut significantly by avoiding insurance-based routine care services. Most offices have a practice overhead that has ballooned to 70% or more. This massive overhead is directly attributable to the health insurance rules and restrictions in place for the delivery of routine health care. And these extraordinary administrative burdens and costs are the reason why there are only a few solo practitioners remaining. Since most care is generally affordable routine office-based and outpatient care, a cash pay system for routine care would also eliminate the costs associated with authorizations, billing, claims filing, and the endless claims challenges made by health plans to delay and deny payments. Cash pay for routine care would cut the 70% overhead significantly. As well, cash pay health care for routine office-based and outpatient care would offer physicians and providers much better margins, faster pay, and make office practice much more convenient and efficient. Even better, the HEALTHdrum platform can restore the physician's ability to make independent healthcare decisions, eliminate friction, and reclaim their profession. So let's summarize the many benefits of a cash pay healthcare system for routine, office-based, and outpatient care. There are several healthcare areas where insurance is typically not involved: weight loss, infertility, and cosmetic surgery. As a consequence, cash pay healthcare in these arenas has resulted in market forces and a stabilization or lowering of costs. Cash pay healthcare eliminates many of the restrictive barriers, inefficiency, and expenses associated with insurance-based healthcare. As well, it eliminates a significant amount of fraud. And there are two other very important benefits that only a cash pay healthcare marketplace platform can deliver: free market healthcare, which will result in stabilization or a lowering of costs for most healthcare services, and value-based healthcare, which is absolutely impossible while insurance plans control virtually all pricing, access, and delivery of healthcare. Only free market healthcare can deliver value-based healthcare. In this video, we talked about the many benefits that a cash pay system for routine healthcare would deliver for consumers, employers, and physicians. The HEALTHdrum book and pay platform for routine care has eliminated many of the unnecessary and complicated rules, inefficiencies, and expenses that are associated with routine care accessed through an insurance plan. To learn more about routine medical conditions and fact-based healthcare, check out these other videos.